Hi, I'm Dr. Craig Castanet of Backstrong Clinic. We're a physical therapy and chiropractic clinic located in Tucker, Georgia. We're immediately adjacent to Atlanta and we're right off 285, so we're convenient from all of the metro Atlanta. We specialize in spinal problems non-surgically, especially herniated discs, sciatica, pinched nerves, spinal stenosis, degenerative disc disease, and we also treat physical therapy to include the extremities, shoulder problems, knee problems, hip problems. But our special focus is spinal problems, and we have a unique approach to treatment. In addition to the conventional exercises and core strengthening and aerobic exercises you'll get and spine-specific exercises, we also include spinal decompression in the treatment of most patients. The reason is that the cause of most spinal pain, whether it's the neck and the back, is from the slow progressive degenerative process that happens to almost all of us at one or more levels in the spine. I'm going to use this spinal model to explain the process, but over time the discs, which are in between the vertebrae, and let me orient you for a moment, these are the bones in the low back or the vertebrae in the low back. This would be the back of the person right here, so if I rub my hand up and down their back, my hand would be here. These are subcutaneous, meaning you can feel them under the skin when you touch somebody. This is the front of the spine. From above down, the view here, you can see that there are 12 to 25 layers of disc. This is tough fibrous tissue. Inside there's a more water-containing gelatinous component that's made to distribute the compression of our bodies around to the disc. And then there are the joints behind that determine by their orientation the directions in which we can bend forward, backward, sideways, etc. The typical pain generators or sources of pain in the spine are the disc, number one. Joints can be a source of pain, and nerve roots can get pinched by extruding or herniated disc material here. The way we treat this compressive process is to reverse or decompress the process, and the way you do that is we place people on a table. It's very comfortable. The table slowly separates these vertebrae. It gets more water, oxygen, and nutrients into the disc. That improves the chemical environment within the disc. That makes it more favorable to the cells that live in the disc. Those cells can then divide. Those cells then make more molecules to repair the disc, and that's how people get better clinically. We, through the process, can generally get improvement in the height of the disc and the water content, as well as getting this bulge herniation to encourage it to return back towards where it came from. And most people will get significantly better or resolved of their problems without the need for injections and surgery. We do treat a number of people that have had injections and surgery already. Injections sometimes don't work. Other times they will stop working after some period of time. Other times patients want to try an alternative rather than just resort to injections until they stop working, and then they have to resort to surgical decompression. Surgery is generally done for two reasons in the spine. The less common reason is for issues of stability, meaning that the spine is not stable, it's slipping around too much, that can be a source of pain. The bulk of the reason for spinal surgery is surgical decompression, whether it's from joints, discs, compression on nerve roots. It still boils down to decompressing painful components and tissues. That can be done oftentimes, in fact usually non-surgically, through our means of treatment, and that's why we focus on decompression as a fundamental approach to the treatment of spinal problems. In fact, I would argue that decompressing a spine ought to be done as a litmus test before people proceed even to injections. So if we can help you with your problem, please give us a call. You can also check us out on our websites, backstrong.net or atlantaphysicaltherapy.net. There are a host of videos on both sites that explain the various pathologies in the spine and elsewhere and how we deal with them using models, MRI scans such as this to show you what a herniated disc looks like. We try to explain the nature of these problems, and I think a better way than, unfortunately, most doctors have time enough to explain them for you. So please feel free to use those resources. If we can help you in any way, please give us a call and we'll be happy to help you with your problem. Thanks very much. Bye-bye.